important that we continue to get our word out and get messaging out for the hospital and confirm what everybody's hearing. We did have a community forum that was set for this last Monday. We had to cancel it because of the disaster, so thanks for working with us. And we have rescheduled it for Monday, January 23rd, 5:30 at the Vets Building. So everybody is invited to come there. You'll get more of an in-depth report from us, and it'll be updated by then too, right? That's a week and a half away, and I can tell you right now, things are changing on the hour, so you'll have the most updated information then. So I know I only have a few minutes, so I'm going to give a very condensed version of where we are right now. Is it important for me to tell you how we got here so quickly? A quick summary. So we run on very thin margins in healthcare across the United States. It is estimated half the hospitals across the United States will run on negative margins in 2022. So that is kind of an industry thing that we have very thin margins, more money going out than money coming in. We were running on a very thin positive margin last fiscal year. And as you know, when you're doing that, any blip in the road is going to change that. And that's what we had July 1 of 2022. We had a change in our Medicare payment. It's an estimate that Medicare does. What they do is the federal government will say, we're estimating we're paying you under or over, and they make an immediate adjustment. That's what they did. They said that they were paying us over. They made an immediate adjustment. I won't go into the details. I will in the community forum. But had a change in over $950,000 a month just in Medicare. Not many hospitals in California or the United States can stand a $950,000 a month change. That's what we were looking at. So, and it started immediately. So we had several things going on, and our board had to declare a fiscal emergency in November. And this is not about debt. This is about cash flow. If we look at our debt, really, we're not backwards in our debt. Our obligations are much less than our assets. We are looking at operational cash flow on a daily basis. So that's where we were in November. We were looking at running out of money in December. We made some changes, and in December, we were still doing okay. We sent out a warn notice to our employees in December saying we're running out of money now, February 18th. We've done operational savings to try to shift things as much as we can. We're actually now have made progress, and we're looking at mid-March. I don't have an exact date, but we're looking at mid-March. We will continue to make our operational savings. We have opportunities at Hazel Hawkins, and we will continue to do that. In the meantime, in a parallel path, we are looking for emergency funding. Our plan, our strategic plan, is to find a partner for Hazel Hawkins. Hazel Hawkins is known for years that it's become more and more difficult to stay independent for any rural hospital across the United States. We're seeing it all the time. It's projected in 10 years there will be no more independent rural hospitals in the United States. We need to come together. We need deeper pockets, if you will. We need some more stability. We don't have that staying independent. So our plan is to find a strategic partner. In order to do that, we need time. We're estimating, and I think it's a little aggressive, we're estimating we need 6 to 9 months to find a partner, get in with somebody that can have a plan with us. We have a great master plan going off once we get stable, right? We know where we need to grow. We know where we need to recruit physicians. We have all that, but in the meantime, we need to get stable. So we're looking for some funding. You might have heard we went to the county. We hope to continue to work with the county in many different ways. If that's being a unified voice to the state, then it's being a unified voice to the state. I'm committed to working with the county and being together with the county in a unified voice. We have gone to the state. We meet regularly with, in fact, we have a standing meeting now with Rivas and Caballero's office. I met last week with Panetta's office. I have a meeting next week with Loughran's office. We will continue to push. I am committed to continue to push to see if we can find emergency funding. We need what we call a runway. A runway will give us the time to find the strategic partner so we can move on. I want this hospital to be here for at least another 60 years, right? I was born here, my daughter was born here, my mom worked here for 40 years at Hazel Hawkins. We have to find stability, and that's our plan right now. So we need $10 million will get us, right now we're looking probably to the end of September now. With the changes that we're making operationally, that's extended. So if we can find $10 million, a proposal has gone to the governor's office. We submitted that last week per their request, and we need emergency funding. And we will continue to make operational changes. I can give you a list of what we're doing, but we've saved millions in the last couple months. We really have. We've reduced some of our positions. Some of the staff have taken reductions in pay. We have those of us that are exempt. We have postponed any raises that we might get. We have switched some of our physician contracts. We're looking at all of our contracts. We have invited our unions to mediation, as well as our payers, our debtors, and our suppliers to mediation to open up some contracts. We have not filed for bankruptcy for many reasons. One of them is we were looking for funding. Some of our funders said if we go into bankruptcy, you won't get your funding. So we're trying to stay out of bankruptcy, but now we're going and doing some actions that would get us the benefits of going into bankruptcy without going in. Bankruptcy is going to take a lot of time, and it's going to take a lot of money, that of which we don't have right now. So we did receive a small loan through the state yesterday, State Treasurer's Office, through CHFFA. I don't want to really call it a loan. It's an advancement in a quality program that we have with the state. So it's a little complex, but we did receive an advancement from them. That also helped us get to March. So that's where we are right now. I do want to say, again, I'll go into much more depth at the community forum. I do want to say this though, we are looking at running out of cash mid-March. If we are not successful, by the way, we do have a building for sale in San Benito County. If anybody's looking for, we have surplus property, we listed that as well. I can connect you. So we're doing all kinds of operational things like that, but if we are unsuccessful with our funding efforts, our operational changes, we are looking at potentially closing the hospital. It's our reality. It is absolutely our reality.
Mary, is there a plan to contract at all? There's some rumors going around that contract, keep ER, keep anything, med-surg, keep something, or
So
is it just shut the whole thing down?
Let me thank you for asking that question. It would be a phased closure. We're hoping. We all just saw Madera, who had to close just like that. They had an exodus of staff. That's our reality too. I just came out of the last 2 days, three employee forums trying to make sure our employees know what's going on. We need to retain them. Because if we're at risk of closing early, it's gonna be because we lose staff, like Madera did. But what we're looking at, last week we did close down one of our services. We continue, when we're looking at operational savings, we look at underperforming departments. Home health was an underperforming department for us. We're at risk of losing $1.3-ish million this fiscal year just in that service line. So the board, upon recommendation from administration, decided to close home health. Not an easy decision, but I want you all to know that there are 6 other agencies in San Benito County that provide that service. We are not leaving our residents without that service. It's just, it's difficult for a hospital-based home health department really to make it. we will be saving over $1 million in wages and benefits from closing that department. So we're tracking our savings so we can project our date. We will continue to look at services that are duplicated in San Benito County first, if we're gonna close anything down, and then we'll go into other areas that are outpatient, that do not affect the hospital to close down. Then, if we're still not successful, we'll continue to try to shrink our size, if you will. It will hopefully not be an immediate shutdown. The last thing that would go would be the emergency. If we have an emergency room though, we have to have lab and imaging and dietary and 8 other services. So it's a really, like I said, complex. We will look at maybe potentially going down in bed size before we close. We do have to give notice to the state that we are in this situation. We are in the midst of that right now. So we have to there's certain days we have to give notice. And remember, this district includes the acute care center, 2 SNFs, and 7 clinics. We do have to give notice for the SNFs and the hospital with the state, and it's...
Mary, tell them what a SNF is.
Oh,
No one knows.
Sorry. Thank you, Gary. And we're horrible in healthcare
You are.
in Athens. We are horrible. Skilled nursing facility, the Maybe facilities, where we have, as of today, I think about 95 patients. 75 of those are long-term care patients. And that is probably gonna be the hardest thing to shut down, because the surrounding facilities are gonna be difficult to place these patients. So the state's saying, hey, if you guys are thinking about shutting this down, we need to get going on that. We are working with Chris and her team on potentially what it's gonna look like if we do have to shut down the hospital. So what you're gonna start to see is notices that the hospital's shutting down. We have to do that. Regulatory, we have to do that. You're gonna start seeing it on our website, you're gonna start seeing posters, you're gonna start seeing flyers, you're gonna start seeing it everywhere on social media, because we have to do that. We can retract that, we can pull it back, but they are requiring us to put it out there. Doesn't mean we're closing. We will let you know if it's a final closure, but those notices have to go out. We're not giving up on all the other things we're working on as that's going on. We have a different team on that. But that's what you will start to see, is that the hospital is closing. So please contact us if you have questions, because we do want to be the source of truth here and try to make sure that everybody's getting the same message. We'll be working with the county individuals as well as other, and by the way, the mayor too. She's been wonderful. And in fact, she is working with us on that community forum. So, yes.
Yeah, Mary, my question's about the skilled nursing facilities. Do they have to close at the same time if you close the hospital? Because I know it's very complicated to close down.
And you bring up a very good point. This is difficult for me on the business side because our skilled nursing facilities make money. But they're probably gonna have to be the first things that we start to shut down, because it's gonna take so long to do it. The hospital, we can send our patients out to other hospitals in our nearby area. Skilled nursing facilities are gonna take a long time. Those 75 patients to place them will take a long time. The reason we make money on those is because they are a distinct part of the hospital, meaning we get paid different than a freestanding skilled nursing facility does. That's why we make money on them. It's an actual Medi-Cal thing, and we get paid very, very well on those. But the state's telling us we have a certain time to shut them down and to place these patients, and we're trying to work through that. So we get that payment because it's a distinct part of the hospital. If the hospital's gone, we're not making that money again. They would have to be freestanding facilities that are would be difficult to keep in the positive.
Is there something that would be, easy is the wrong word obviously, but I guess more easy to have a private provider come in because
Sure.
it's non-profitable and maybe you don't have to displace all the patients?
Sure, but it's profitable because it's connected to the hospital. So unless another hospital wants to come in, put it on their license. I don't even know if we can do that though through the county lines. We're looking into that right now. What we're trying to do is find a solution for those skilled nursing facilities so we don't have to move the patients. It's proven proven that if a patient is closer to their family members, that they do much, much better. So we are doing every effort to be creative, to think of what we can do to keep those folks in San Benito County. I've missed a lot. There's a lot in between all of this, and we will go through it at the community forum. But are there questions? And I know some of you have submitted questions that we will answer at the forum. Thank you so much for submitting those, and we will try to answer them again.
We're gonna do very general questions if you don't mind, and like Mary said, let's keep anything very specific for the community forum. I hit Mary up at the last minute, and I appreciate her coming here and providing us just a general update so you guys know in all your businesses and organizations what's happening. But this isn't a session for us to get into the minute details of what's going on with the hospital. And I just make one last comment, and we'll go over here to Keith. So if you guys aren't familiar with the Madera County Hospital situation, essentially what happened, Madera was very close, this close, I'll hold my fingers up, I don't know if that's true, to making a deal to selling privately,
this
having somebody
close.
take over. And the Attorney General's office stepped in in the state of California, and essentially the private person said, oh, that's way too complicated, I'm simplifying it. We don't want to get involved with that, we're gone. So hopefully with your advocacy, all of us in here, our advocacy, I'm looking at you guys, our state folks, we can make sure that doesn't happen if the hospital here is getting close to making a deal. Keith, please go ahead.
How close are you in nature to Watsonville and Watsonville Solution?
Watsonville Solution is much different than ours. So Watsonville Solution is actually reverse of what we're trying to do. So they created a district, and that's what we are right now. We had a conversation with them last week as well. We're trying to learn from them. They're very generous with their time. It is quite different. They did get a lot of state help, but that was a different situation than what we are. So, but we are looking with them and communicating with them to learn. Yes.
So I just had a question about the timing of the forum, and then I'll save my questions for that.
It's
When is it happening?
the 23rd,
23rd.
January 23rd, 5:30 p.m. at the Vets Building.
Great, thank you.
It is a Monday. It is a Monday. We had to work with the Vets Building in their time and our persons that are helping us with their time.
Maybe after the storm, like we heard from Chris too, maybe so calm down a little bit. I should have said that.
And knock on wood. And we are looking for, thanks to the recommendation, Supervisor Gonzalez, we are looking for like a backup building in case.
As are we. We've already secured a backup location for an
Okay, thank you.
Yes.
Any other overview type questions for Mary?
Yes.
No, Mary, I don't have a question. You are rarely probably going to hear this, but I just, with your experience, not only as a board member, but in hospitals in the past, I just want to say thank you for all that you're trying to do here. Because it's not easy to be in your position. I don't envy you. But certainly thank you for what you're trying to do here. It means a lot to us. So keep it going.
My heart is here.
Yeah.
You know, 28 years of healthcare experience, and I've never worked at Hazel. It was always assumed, right? I'd go to x-ray school. My mom always said it was assumed. Lil's daughter would go to x-ray school and work at Hazel Hawkins, and I never did. And I've been watching it from afar all this time and lived here all my life. I never moved out when I was working in healthcare, and my heart is here. I was born here. My daughter was born here. So I'm not giving up. There's no way I'm going to give up. We have to find funding. We need this